Snake bite, fang mark. Classically, there should be two puncture wounds which are separated from each other by a distance varying from 8 mm to 4 cm depending upon the species involved. Fang mark in a viper bite. Fang mark in a viper bite. However, a sidewise viper may produce only a single puncture, while multiple bites could result in numerous fang marks. Identification of snake. The method of identifying a venomous snake has been. This can be attempted in those cases where the victim officers bring them with the culprit dead snake. Extreme caution is imperative in this context. There are a consequence. Also, even experienced medical personnel may mistake harmless mimics of venous snake or they confuse different venomous. Okay. Laboratory investigation hematologically. WBC, early neutrophil leukocytosis. There's an evidence of systemic enabling from thrombocytopenia in viper. Viper thrombocytopenia mostly common in hematologically in viper. And at the WBC count കൂടുന്നതാണ് വൈപ്പറിൻ്റെ അകത്ത്. പിന്നെ ഹെമറ്റോക്രിറ്റ് ട്രാൻസിയൻറ്റ് ഇൻക്രീസ് ഇൻഡിക്കേറ്റ് ഹെമറ്റോ കോൺസെൻട്രേഷൻ റിസൾട്ടിങ് ഫ്രം എ general rise in capillary permeability. Example in Russell viper bite. More often there is a decrease reflecting blood loss, and in case of Russell viper bite, intravascular hemolysis. Evidence of hemolysis, fragmented RBC, schistocyte or Hemmel cells. Prolonged clotting time, prolonged prothrombin time, prolonged partial thromboplastin time, prolonged partial thromboplastin time, decreased fibrinogen level, elevated FDP fibrin degradation product. 20-minute whole blood clotting test. This is very helpful and informative bedside test. Requires very little skill. Only one piece of apparatus, a new clean dry glass vessel, tube or bottle. Place 2 ml of freshly sampled venous blood in a small or new or heat cleaned dry glass vessel. Leave undisturbed for 20 minutes at ambient temperature. Tip the vessel once. The blood is still liquid, unclotted. Runs out. The patient has a hypofibrogenemia. Coagulable blood as a result of venom-induced conception coagulopathy. In Southeast Asia region, including India, incoagulable blood is a diagnostic of a viper bite and rules out an elapid bite. The vessel used for the test is not made of ordinary glass, or if it has been cleaned with detergent, it will not stimulate clotting of the blood samples. Surface activation of the factor 11 Fagman factor. The test will be invalid. If there is any doubt, repeat the test in a duplicate including a controller. Blood from a healthy person as a relative. ECG. Common ECG changes include bradycardia with ST segment elevation or depression, T wave inversion, QT prolongation changes due to hyperkalemia. Then amino transferase and muscle enzymes, creatine kinase aldolase will be elevated. If there is a severe local damage, or particularly if there is generalized muscle damage, sea snake create Russell viper bite. Mild hepatic function dysfunction is reflected increase in other serum enzymes. Bilirubin is elevated following massive extravasation of blood. Potassium, creatinine, urea, and blood urea nitrogen levels are raised in the renal failure of Russell viper, hump-nosed viper bite, and sea snake. Early hyperkalemia may be seen following extensive rhabdomyolysis in sea snake. Bicarbonate will be low in metabolic acidosis, renal failure. Arterial ABG pH may show evidence of respiratory failure, neurotoxic enerving, and respiratory metabolic acidosis. Metabolic hyperkalemia, hypoxemia, metabolic acidosis, lactic acidosis, urine. Color of the urine, pink, red, brown, black should be noted. Hematuria, myoglobinuria. And the urine should be tested by dipstick for blood or hemoglobin or myoglobin. Standard dipstick does not distinguish blood, hemoglobin and myoglobin. Hemoglobin and myoglobin can be separated by immunoassay, but there is no easy or reliable test. A microscopy will confirm whether they are erythrocyte in the urine. Red cell cast indicate glomerular bleeding. Massive protein urine is early sign of generalized increase in capillary permeability and Russell viper anemia, and early indicator acute kidney injury. Acute renal failure, all features assorted may be present. Chest X-ray, pulmonary edema, intrapulmonary hemorrhages, pleural effusion. Immunodiagnosis, immunological detection of venom antigens in the body fluid can be accomplished by ELISA. This is very highly sensitive, but specificity may inadequate distinguishing two different species of snakes. Thank you.